evolving guidelines of MPNs today?
Sure. Well, NCCN came out with inaugural guidelines in MPNs, and it was my pleasure to update the audience here at the Chemotherapy Foundation regarding those guidelines. In particular, we focused first on diagnosis, prognosis, and symptom burden, validating and endorsing the WHO criteria for diagnosis, the already recognized prognostic scores in these diseases, as well as the importance of symptom assessment. The guidelines have really begun first with the therapy of myelofibrosis, and help to clarify an assessment of risk and burden in patients. We then stratify really by the risk itself, and then stratify patients between those that we observe, such as low risk asymptomatic, those that we consider for medical therapy with ruxolitinib, symptomatic low risk, symptomatic intermediate 1 risk, intermediate 2 and high risk for improvement of splenomegaly symptoms, potentially disease course, as well as trying to clarify where we consider clinical trials, which is pretty much all along the way, as well as the importance of stem cell transplantation, in particular for intermediate 1 with high risk molecular features, intermediate 2 and high risk in good transplant candidates, and crucially for individuals that are evolving toward acute leukemia. So we hope that they will provide greater clarity and provide greater uniformity of care for myelofibrosis in the U.S.